Κύριε Πιτούνη, ευχαριστώ πολύ. Ευχαριστώ και την διοίκηση για την πρόσκληση σήμερα. Λέμε στην χειρουργική ότι ο εχθρός του καλού είναι το καλύτερο και ακούσαμε ήδη σήμερα για το χειρουργείο του αιώνα που είναι η Κεραμική Αρθροπλαστική του Ισχύου. Επομένως, όλοι σας σκέφτεστε, αφού έχουμε ένα χειρουργείο που δουλεύει καλά, γιατί να το αλλάξουμε και να κάνουμε κάτι καινούριο. Για μένα, όταν μου λένε ο εχθρός του καλού είναι το καλύτερο, δεν το θεωρώ αυτό σαν δικαιολογία να μείνω στο καλό, το θεωρώ πάντοτε σαν πρόκληση να καταφέρω το καλύτερο. Και γι' αυτό το λόγο πριν 10 χρόνια και εγώ, όπως ακούσαμε πολύ ωραία από τον κύριο Τσαρούχα, ξεκίνησα να χρησιμοποιώ την πρόσια προσπέλαση, γιατί θεωρώ ότι σίγουρα είναι η καλύτερη προσπέλαση σε ό,τι αφορά λειτουργικά αποτελέσματα για τον ασθενή. Μία παρένθεση εδώ να σας πω ότι είναι απόλυτα extensile το anterior approach και proximally και distally. Δεν υπάρχει κανένα πρόβλημα στο να κάνεις extend, να δεις δηλαδή και την κοτήλη και το proximal femur. Και όσο αφορά τα κατάγματα του τροχαντήρα, ο λόγος που το μεγαλύτερο ποσοστό, θεωρώ το 90% των καταγμάτων του τροχαντήρα, δεν χρειάζεται να τα κάνεις fix, είναι ακριβώς επειδή έχεις το continuity των μαλακών μορίων, επομένως δεν χρειάζεται να κάνεις τίποτα, τα αφήνεις όσα έχουν. Και πολλές φορές όταν κάνουμε revision του femoral stem μέσω ενός anterior approach, κάνουμε ένα ελεγχόμενο κάταγμα του τροχαντήρα, προκειμένου να έχουμε το πλήρη approach και access στο μυριαίο. Λοιπόν, θα σας μιλήσω σήμερα, αν καταφέρω. Λοιπόν, θα σας μιλήσω σήμερα για το ceramic hip resurfacing. Θεωρώ ότι είναι και διάλεξα αυτό το θέμα για δύο λόγους. Πρώτα απ' όλα γιατί φαντάζομαι έχετε βαρεθεί να ακούτε για ρομποτική, επομένως έπρεπε να πω για κάτι άλλο. Το δεύτερο είναι επειδή θεωρώ ότι είναι ένα αντικείμενο, ένα θέμα, το οποίο εναρμονίζεται απόλυτα με τους δύο βασικούς πυλώνες του modus operandi της διοίκησης του ομίλου του ιατρικού, που είναι αφενός το innovation και το δεύτερο είναι τα international collaborations. Innovations, βλέπουμε εδώ από τις φωτογραφίες ότι πρόκειται για η κεραμική αρθροπλαστική επιφάνεια, το ceramic hip resurfacing, πρόκειται για την βελτίωση μιας ήδη υπάρχουσας τεχνικής, η οποία έχει εξελιχθεί από τον καθηγητή, από τον Professor Cobb, στο Imperial College London και όπως όλοι γνωρίζουμε το collaboration του ομίλου του ιατρικού με τον όμιλο του Imperial στο Λονδίνο. Και εδώ βλέπουμε πάνω δεξιά είναι η ομάδα από το Musculoskeletal Lab στο Imperial. Οι εικόνες από κάτω, αριστερά ξεκινάμε, είναι το Cleveland Clinic, στο οποίο δουλεύω και συνεργάζομαι μαζί με τον Professor Cobb. Δίπλα είναι το κτίριο του Musculoskeletal Lab και τα εργαστήρια όπου έχουν γίνει οι τεχνικές που έχουμε καταφέρει να ενωθεί, να ενσωματωθεί μάλλον το κεραμικό υλικό με το μέταλλο, έτσι ώστε να έχουμε ένα uncemented ceramic hip resurfacing. Τα υπόλοιπα θα σας τα πω στα αγγλικά, συγγνώμη. Λοιπόν, talking about hip replacements and gait. We know from gait lab and gait studies that the biggest problem with the motion or the gait or the function following a total hip replacement is that normal stride requires full extension. And we know that total hips don't extend normally, and therefore they depower the gait, explaining why people with total hip replacement, as a general rule, tend to walk slower. And you can see here from the graph on the left, the blue is normal, and the green and the red represent different types of hip replacement. And you can see how, with normal stride, in the normal individual, you can get full extension and a better stride, as opposed to people who have had a hip replacement. And this is a nice graph that I like very much. Again, μ' αρέσει αυτό το γράφημα εδώ πέρα, γιατί θα συμφωνήσει, ελπίζω, και ο κύριος Σαρούχας. Βλέπουμε εδώ πέρα αριστερά, η κόκκινη γραμμή, η πορτοκαλί γραμμή είναι το φυσιολογικό. Η μπλε γραμμή, μάλλον δεν το βλέπετε πάρα πολύ καλά. Υπάρχει και δεν έχω και ένα pointer να σας το δείξω. Κάτω από την κόκκινη γραμμή, στο γράφημα αριστερά, υπάρχει ένα interval που είναι το φυσιολογικό. Πιο κοντά σε αυτό το φυσιολογικό είναι η κόκκινη γραμμή που είναι η πρόσθια προσπέλαση μετά από αρθροπλαστική ισχύου. Το μπλε είναι η οπίσθια προσπέλαση και το κίτρινο είναι το hardening, το lateral approach. Και βλέπουμε ότι ενώ από τις ολικές αρθροπλαστικές ισχύου η πρόσθια προσπέλαση είναι εκείνη που πιο κοντά αναπαράγει το φυσιολογικό, τα φυσιολογικά biomechanics της άρθρωσης του ισχύου, βλέπουμε δεξιά στο γράφημα ότι με το ceramic hip resurfacing έχουμε απόλυτη αναπαραγωγή and full reproducibility of the normal biomechanics of the hip joint. Birmingham hip resurfacing, we all have heard about the Birmingham hip resurfacing, and we know that it has good results. However, these results have been diluted in the past because of problems with a specific type of hip replacement from another company and issues in terms of training, insertion, but more importantly, issues regarding metal ions relating not so much with hip resurfacing, but more with large metal-on-metal hip replacements and the problems with the tranion. But we know for a fact that hip resurfacing is the best option for athletes. It is the best option for large men. And you can see here famous examples of people who have had hip resurfacing and have managed to return to competitive tennis player following their operation. This is basically the steps that we followed during the development of the H1 ceramic hip resurfacing system. It started in 2008 with feasibility prototypes and various studies that led effectively in 2018 to 5 centers in the UK and 8 surgeons inserting the first ceramic hip resurfacings, and that's where I got involved back in 2019. Eventually doing 2,050 patients in the clinical study and getting the CE mark about a couple of months ago, and looking at a commercial launch and release in Europe in the early months of 2025. Και είμαι πολύ χαρούμενος να πω ότι η πρώτη χώρα στην Ευρώπη που θα κάνουμε το πρώτο ceramic hip resurfacing θα είναι η Αθήνα και ο όμιλος Ιατρικού, όπου θα μας επισκεφτεί ο Professor Cobb και θα ξεκινήσουμε να κάνουμε το χειρουργείο εδώ πέρα στην Αθήνα. A few things about the hip resurfacing implant. You can see here the special design of the hip resurfacing. It has a special counter anteriorly in order to avoid iliopsoas impingement. And therefore, this provides increased coverage without allowing any overhand of the implant and creating anterior pain, as has been occasionally been reported. And this is exactly what the acetabular implant looks like. The important thing, or the clever thing about the ceramic hip resurfacing, is the ability to incorporate the ceramic on the metal coating. And you can see here the various studies that we have performed in the lab to allow the ceramic to incorporate with the metal coating and eventually allow this uncemented metal fixation with a ceramic surface. And this is exactly what I mean here. You can see on the picture on the bottom right how the various studies that have looked how the ceramic can bond with the metal, and the various studies to see how hard it is to debond the metal from the ceramic. And that has been part of the designing process and eventually the application to obtain the CE mark that will allow us the commercial launch of this prosthesis. So the H1 ceramic hip resurfacing, it is anatomic, it is cementless. We have more than 4 years of preclinical work and approximately 7 years of clinical data. And as I say, the CE mark via the MDR, the new MDR rules, which are very tough in Europe, was awarded in September of this year. And we are looking at the commercial launch in the European Union and in Greece being the first country in 2025. This is the 2 very famous, some of you will recognize them, 2 very famous hip surgeons in the United Kingdom. On the left, you will see Professor Justin Cobb, who is the designer of the prosthesis. And the third from the left is Miss Sarah Muirhead-Allwood. Collectively, the 2 of them have operated on some very famous people and probably half of the royal family in the United Kingdom. And they have been part of the designing team for the H1 ceramic hip resurfacing. Now, how you insert the H1 ceramic hip resurfacing and the approach is entirely dependent on preference, but specifically because both Justin Cobb and myself are big supporters of the anterior approach, we have designed specific implants, specific instruments, so we can do actually the hip resurfacing through an anterior approach. And for me, this is the holy grail of hip replacement, hip operations. On one hand, you're choosing a biomechanical technique, which is the hip resurfacing, that we know functionally it is better for the patient, but you're actually combining it with the anterior approach that we know preserves muscle and therefore even further aids in the recovery and the good functional outcome for the patient. So combining hip resurfacing with anterior approach will give the best outcomes for your patient. You can personalize the plan, and you can use PSIs, you can use computer planning in order to make sure that you get the right positioning of the femoral head implant and the acetabular component. A few things, I'm not going to bore you, I know we're running out of time, but basically you need to choose specifically the valgus, you need to position the femoral head component in relative valgus, because, again, I cannot point, but because it's the medial calca, the medial part of the femoral neck which is important, and you need to protect it from stress shielding. And equally, you need to choose the appropriate inclination of the acetabular cap. And again, careful pre-op planning with various computer planning systems can help you for that respect. So, we know that Birmingham hip resurfacing is wonderful. However, it is not an option for women so far, or many Greek men, like men of my size. And there has always been, and there will always be, certain concern about metal ions. The H1 ceramic hip resurfacing is promising. It offers 7 years of experience. It can equally well be done in women and men. And really, the worst outcome after a hip resurfacing that has failed is to convert to a short stem total hip arthroplasty, which we've heard from all the previous lectures that it is actually the best operation in the world. So it's really, you don't have a lot to lose by trying to give your patient a better biomechanical operation. The approach is agnostic. In other words, you can insert it through the posterior, the lateral, or the anterior approach. And I'm very pleased to say and announce, following the international collaboration that the Athens Medical Group has with the Imperial College, that Greece and Athens Medical Center will be the first group in Europe to insert such a prosthesis in the new year. The outcomes, we have looked at clinical and radiographic outcomes, survival, PROMs, gait, motion capture. It has been very thoroughly studied. You need all this data after all, because otherwise you cannot get a CE mark through the MDA in Europe at the moment. Excellent range of movement with almost zero risk of dislocation. You can see here serial radiographic studies, pre-op at 3 years, at 7 years, and again with excellent function in terms of stability and range of movement. This is a 42-year-old dancer with pain and subluxation, and you can see here post-op at day 1 and 3 years post-op, showing this acetabular osseointegration and a good periprosthetic bone quality. This is a gentleman who is posting his Strida runs on a daily basis. This is post-op at 1 year and 5 years, again showing excellent osseointegration. And this is his distance that he very proudly posts online on a regular basis. There you are. This is not bad considering a new hip in February, thanks to Professor Cobb, and he has just done 5 miles run. This is a 49-year-old rheumatologist, 1 and 5 years post-operatively, again with healthy remodeling of the head and neck and 5 years post-op. In terms of our results, out of the 250 patients, there has been no deaths, no infection, and 100% follow-up. Only 3 operations, all revisions for fractures. But as I say, you can have a fracture of a ceramic hip resurfacing, and the worst thing that can happen to that is that you need to convert it to a short stem total hip replacement. Whereas if you have a periprosthetic fracture or about a total hip replacement, you end up killing the bone with massive plates, wires, and screws. What's best? Clearly, in my view, converting a simple operation like a hip resurfacing to a total hip replacement, it's much better rather than having to do with a periprosthetic fracture around a total hip replacement. So all 5 of the above domains show very promising data at 7 years follow-up. So why change to ceramic hip resurfacing? As we said, and we've heard that we know total hip replacement has very good and reliable results. Why change? In my opinion, you need to change because it offers better biomechanics, and there is no doubt about that. It offers a better gait. It offers better patient satisfaction. It definitely offers improved ability to do sports, and in turn to all types of activities of daily living. It is an easier and more predictable revision when things go wrong. And with the ceramic bearing surfaces, there is no issue or no fear with metal ions. Thank you very much.